Hospitals face soaring costs from plastic waste crisis. North America's healthcare sector is facing a mounting crisis driven by its reliance on single-use plastics. A new joint report from Eunomia and Systemic projects that, without urgent action, hospitals across the US and Canada could face up to $37 billion annually in plastic waste management costs by 2040, a 28% increase over today's expenses. The numbers are hard to ignore. In 2023 alone, 1.2 million metric tons of single-use plastic waste were generated by healthcare systems in the US and Canada. That plastic translated into 4.3 million metric tons of CO2 emissions, much of it tied to energy-intensive production and disposal processes. It's the highest output of any region studied, and the environmental toll is accelerating as global carbon pricing and climate regulations tighten. The financial strain goes deeper than waste disposal. Hospitals have become locked into a system that favors convenience. Gloves, tubing, rigid devices, PPE, packaging, and wipes are typically used once and discarded. These items are procured in high volumes across nearly every department, inflating both budgets and emissions. Though initially introduced for infection control and logistical efficiency, the widespread use of disposables has reached unsustainable levels. Experts involved in the report note that in many cases, especially with items like gloves or certain packaging, usage patterns go far beyond what's clinically necessary. As one consultant put it, healthcare has fallen into a default to disposable approach, even when safer, cost-effective alternatives are available. A circular shift, 5 strategies for reform. To address this, the report outlines a 5-pronged approach aimed at embedding circular economy principles into healthcare procurement and operations. If implemented system-wide, these strategies could slash waste dramatically and save nearly $8 billion annually by 2040. 1. Reduce and refuse. The most immediate gains can come from cutting out unnecessary plastic use, especially in routine items like gloves, which are often overused due to habit rather than medical necessity. Targeted interventions can lower volumes without compromising safety. 2. Reuse. Reusable medical products like gowns, surgical trays, and certain face masks present one of the largest cost-saving opportunities. These options reduce the volume of waste while maintaining clinical performance. 3. Substitution. While not appropriate in all settings, swapping plastics for compostable or paper-based materials can reduce environmental impact when done within safety guidelines. 4. Better recycling. Optimizing waste segregation and designing products for recyclability can help recover more value from materials that currently go to landfill or incineration. 5. Low-emission plastics. For items where plastic remains essential, hospitals can source materials made from bio-based inputs or manufactured using carbon capture technologies, bringing down the emissions profile of necessary disposables. Collectively, the impact is significant. A 54% reduction in single-use plastic waste, 58% fewer greenhouse gas emissions, and a 21% cut in related costs compared to current practices. Realizing this transformation will take coordinated action across the healthcare value chain. From group purchasing organizations to regulatory bodies, every stakeholder has a role to play. The report calls for regulators to step in where healthcare plastics have been historically exempt from environmental legislation, offering incentives and guidelines that prioritize sustainability alongside patient safety. While the report makes clear that patient outcomes must remain the priority, it also points to the growing health risks linked to plastic pollution. In many cases, maintaining high care standards and reducing plastic use go hand in hand, especially as alternatives improve in both safety and performance.